to the organisers for inviting me. It's a real pleasure, actually, and particularly actually to follow the session that we've just had, because I think what's evident is that there's all kinds of disagreement, and I think I'm only going to make things worse with this next talk. So Celia's asked me to talk about the subjective assessment of spinal ataxia. So my first question is, what's this? Well, the point is, if it looks like a duck, walks like a duck, and quacks like a duck, then it's a duck, right? And the truth is that I think very many of us in the audience are really good at identifying severe ataxia and knowing that we're looking at a severely ataxic horse. That's the duck here. These animals are ataxic. They have a functional deficit associated with defective proprioception. That's the knowledge of the body's position in space. So I think we're all pretty comfortable in recognizing these ducks. What sorts of things do we see that help us decide that an animal is ataxic? Well, there's some controversy at the moment in the literature, but certainly many people feel that the tendency for a horse to pace is something that's seen in some horses with ataxia, and sometimes when that degree of pacing gets worse on head elevation, again, many people feel that that's a sign characteristic of ataxia. Circumduction, particularly of the pelvic limbs, particularly the outside pelvic limb on circling, is something that we see in ataxic horses. And in this lower right video, severe thoracic limb hypermetria, this floating gait. I think if all of us saw these sorts of cases, we would be pretty comfortable in recognizing ataxia. Why is this important? Well, actually, we've heard some of the issues as to why this is important. It's important because it's important that an examination should be accurate and ideally reproducible. It appears, anyway, that there are human safety issues at stake here, financial aspects, particularly in young thoroughbreds. Do we decide to put this animal into training or not, and so on. Genetic aspects, Steve has talked about that. The welfare of the horse. We've just had a discussion about if a horse is at risk of falling over, injuring itself, and so on. Big issues related to pre-purchase examination and insurance. We've heard some of them. The other issue that I think is really important, which is a key part of my talk, is assessing responses to treatment. We need to find a way of assessing responses to treatment, whether that be surgery, Steve touched on this, or other sorts of treatment. Steroids. I bet lots of people here give steroids to wobblers. I would argue that the vast majority of those horses don't need steroids. And ultimately, the decision as to whether to euthanize a horse that's a wobbler. It's really important that we make an accurate diagnosis in that particular case. So what might lead to discrepancy in cases? So we're playing this video, and I'm just going to ask Phil in a moment to pause it. Just watch this horse as it's circling. You are watching the horse and not the dogs. And you can see that this horse starts to develop a rather unusual and fairly dramatic pelvic limb gait. Okay, just pause it there. Right, I'm betting that a significant number of you would probably define that horse as being ataxic. Okay, can we just carry on playing it now? The sound on this video is even better because the dogs are barking as well, which is great. So this horse clearly has an abnormality in its gait, right? And what's interesting in this horse is that the abnormality is getting worse the more this horse is exercised. It starts knuckling in the pelvic limbs, starts struggling to protract its pelvic limbs. It's now starting to develop problems in its thoracic limbs.
going to happen.
Now, the interesting thing about this particular horse, this is an unusual case, that's the first thing to say. The interesting thing about this horse is this happened repeatedly, and within about 10 minutes of this horse going down, it was up and normal again. This horse almost certainly has myasthenia gravis, which has not been reported before in a horse. But the point I'm trying to make is that if you looked at this horse and its gait abnormality, you would probably say, unless you saw the rest of the video, that this horse was ataxic. And you would almost certainly be wrong. This horse is weak. And differentiating ataxia and weakness is often really, really difficult in horses. And for that reason, we very often say horses are ataxic and weak. And that's certainly the case in many horses that have cervical vertebral malformation. They have a combination of the two. And differentiating those two is really hard. The other thing that I think is pertinent here, particularly dealing with young thoroughbreds to this audience, is the extent to which immaturity can affect the gait of a horse. We know, we've heard it earlier said today, but if you look at a toddler walking up and down, they have a dramatically abnormal gait. By the time they're teenagers, that gait is relatively normal, unless they're sitting in front of the television, and so on. The effect of immaturity on gait is probably very marked, but with some exceptions, we tend not to take that into account very much. It's also true to say that very likely there are some people in this audience who are superb athletes, and there are other people in this audience, perhaps me included, who are less good athletes. I'm guessing if you compared our gaits, you would say that some people might end up being capable of being a prima ballerina and other people not. And the same is true in horses, of course. The effect to which gait is affected by breed, the effect to which gait is affected by underlying musculoskeletal disease, and, of course, the experience of the observer. All of these things can influence a discrepancy when it comes to trying to define ataxia. Now, we've already talked quite a lot about grading scales. I like to keep things fairly simple. So this is the grading scale that I use. This is based on Joe Mayhew's work, and it's done when I was working with Steve and so on. So grade 0, that's a normal horse. Grade 1, no gait deficits identified at the walk, deficits only identified during further testing. Grade 2, deficits noted at the walk. Grade 3, marked deficits at the walk. Grade 4, severe deficits at the walk, may fall or nearly fall. And grade 5, these are the recumbent horses. So what I'm going to talk about is a study that was done by Dr. Emil Olsen, who will come on to give the next presentation after me. Emil was a PhD student working at the Royal Veterinary College, and we were really interested in looking at this subjectivity in the neurological examination. And what we looked at over time was 25 horses, and 6 people graded these horses all independently, and then decided what grade they were. We did a load of other things, but I'm not going to touch on that. A number of these horses had been donated for this study, and they were euthanized, and we had a post-mortem examination done on these horses, and it was done where the pathologist was not aware of the grade that the clinicians had given. So 6 raters, all grading the same horse, and we've got 25 horses, at the same time, watching the live examination. So I'm just going to show you a few of these videos. This is the first of these horses. And I want you all to look at this video, and I want you to decide in your own minds, first of all, if you think this horse is normal or abnormal, and then secondly, where you would grade it on that scale. They did have sound. Well, they were there, actually, at the time. You can see them all grading, Sue. They're all at the end of the runway. Okay, so I am guessing that there are some people I'm not going to ask people to put hands up because I think that's a bit unfair, but I'm guessing that there are some people in the audience who think that this horse is normal, and there are other people who think this horse is abnormal, and there are probably a disparity of grades that you might give this horse. This horse was euthanized, and it had a post-mortem and confirmed compression at C6, C7, and an underlying myelopathy. Now look at this next one. Okay, so again, I'm guessing that there's a disparity in this room. Certainly when I've done this before with voting systems, we see a marked disparity. Postmortem, no abnormality detected. So I'm thinking that probably most of you are now saying that you're pretty sure that this horse has got at least some gait issue, if not a neurological gait issue. Postmortem, nothing abnormal detected. And this highlights another issue that I actually wanted to bring up in the panel session, which is the extent to which we use a postmortem diagnosis as a justification of a claim on insurance, because my personal feeling is it should never be used as a justification for insurance. If the claim is being made on the basis that the horse is ataxic, that should be sufficient. To deciding whether the horse has a neurological issue and confirmation from postmortem, while nice, here's a great example of a horse that clearly has a significant problem, but we weren't able to find the deficit. Now, that may just be that we looked in the wrong place, and that could happen with any of our cases. So this is a study that we published. Those of you who are interested might like to go and look at it. Emil is first author. Rater agreement on gait assessment during neurological examination of horses. This was published in 2014 in Journal of Veterinary Internal Medicine. And really what I just wanted to highlight is one figure from this particular study. This is called a violin plot for obvious reasons. And I'm just going to talk you through it. So on the x-axis here, we have the grade of the horse that most of the raters assigned to that particular animal. So, for example, horses that are on this line here, the majority of people said that this horse was a grade 2. The median grade assigned by all the raters was a grade 2. And horses that are on this line here, the median grade assigned by raters was a grade 3 in this case. Down here, the median grade was grade 0. And then on the y-axis, you can see this is the disparity from the median grade within each individual animal. So if we concentrate on horses where the majority of raters said this horse was normal, actually some people said these horses were grade 1, some people said these horses were even grade 2. You look at horses where the median grade was grade 2, assigned by all of the raters. Some people said that it was minus 2 grades from 2, i.e. normal, grade 0. And some people said this horse was 1 grade worse than grade 2, i.e. grade 3. And that's exactly what we've seen in this discussion here. If 6 people can't even agree what grade the horse is, how on earth do we expect to get a fair and justified insurance claim? Leaving aside the conflict of interest that exists when we know we have our client who we want to try to get an insurance claim through, God forbid that ever happens to any of us. So this, to me, is a big, big worry, because it says that actually clinicians can't agree on the grading for neurological disease, in particular, in our case, gait analysis in horses with neurological problems. So this is the summary, really. First of all, agreement between clinicians is reasonable, though not great for more severely ataxic horses. These are the ducks, okay? The ones where we're pretty sure, we're confident in saying that these animals are ataxic. But actually, clinicians struggle to agree when signs of ataxia are absent or mild. Some people will say that's a normal horse. Other people will say, no, it's got mild ataxia, and so on. And the other thing that came out of this study was evidence for bias. What do I mean by that? Well, it means that clinicians were more likely to say that a horse was ataxic if they knew the referral of that animal was for a suspected neurological problem. That's a concern. It basically means you're more likely to say a horse is ataxic if you knew it's been referred for a neurological issue. The same issue is seen with lameness, by the way. There's significant bias with lameness in assessment in horses. If people think an animal is lame in one of its legs, they're more likely to call it lame. If they don't know, which leg the horse is lame on, they're more likely to say the animal is normal. It's the same with neurological disease. So I personally think we need to be honest about the limitations of the subjective neurological assessment. Really, we have to be honest with ourselves and recognizing that particularly in horses that are normal or are very subtly ataxic, you're never going to get agreement across even a room of people who are perceived experts, especially in these mildly affected cases. And of course, this has big implications. It has implications for pre-purchase examination, deciding whether the animal is safe to ride, whether it's going to be suitable as an athlete. And it also has implications for your client. If you say the animal is potentially ataxic, well, that might lead to further radiographs, myelography, general anesthesia. Somebody else might say, no, that animal's normal. Well, that's a big issue for the individual horse. And we've already touched on the issue of surgery. If there's bias in this with this particular disease, I know Steve won't mind my saying this, but you're more likely to define an animal as potentially improved if it's undergone an expensive surgery. And I've already made the issue of trying to decide if an animal should be euthanized or not. If we can't agree on the basis of where the grade is, then that has significant implications for deciding whether a horse should be euthanized. So I already acknowledged Emil, who did this work, and is going to talk to you about a lot of the exciting work that he's now doing and has already done. The RATER study, there are a large number of people who were involved, and I was very grateful to the referring vets who sent in cases. And finally, I just wanted to acknowledge you, Steve, who kind of got me interested in equine neurology in the first place. Thank you very much.